table.
Yes.
I wear glasses.
It's okay.
It's my apologies. I try to fake it. It doesn't work. They say that again, Diana, for me.
They don't want to pay for salaries, already paying tuition.
They don't want to pay for salaries. They're already paying for tuition, obviously, from those folks that are in the academic field. This table over here.
Same thing, they don't want to pay salaries, they want to fund programs, not operations.
Right.
They want a specific cause, like a
Salary.
scholarship. It's not sexy.
Not sexy.
I
That's my
didn't say
favorite.
that.
This is my fourth time doing this presentation. I love it when I get the not sexy one. The goal today is to make it sexy.
There you go. Last but not least, it's like feeding yourself.
Oh.
Self-feeding.
Okay. Okay. That's a new one. I like it.
What was the last thing, comment, please?
It's
like
like
feeding yourself.
feeding yourself.
So say you're an employee of an organization, you make a donation to your organization, you're paying your own salary. That's kind of what it is, right? Linda, what do you have?
Yeah, well, a lot of what he just said, but funders really want specifics about programs.
Programs.
That's what they ask for. Yeah.
Specifics, you mean they want outcomes. They want to be able to measure
Yes.
the impact.
Yes.
And
Yes, yeah.
what was your name again?
Sue.
Sue.
Sue, yeah. The same thing. You all have wonderful
Well, we hear it often, so I mean,
programs and delivering service and outcomes and something to tug at the heartstrings.
right,
To do.
exactly.
Emotions. So.
Good. And these last two tables?
Same thing, not sexy, no results.
Did you actually say not sexy?
Not sexy, but
Excellent. Excellent.
and it's somebody else's job. The
Ooh.
board sees it as, you know, their job is to talk about the programs and it's somebody else's job to raise the
I
bar.
like that. Somebody else's job, feeding yourself. And then what do we got back here?
We don't have anything different than what's.
Okay. And that's okay.
I like you can't put a plaque on it.
You can't put a plaque on it.
That wasn't mine.
I like it. And who do we find, you know, we're all in the same club here. So who's usually saying this to us?
Board foundation.
It's the board. The board? Okay. So obviously what we're going to do today is we're going to talk about how you can fund operations and why it is a good investment. We're going to talk about how you can shift your messaging in order to accomplish just that. We're going to identify those fundable pieces of your budget because we want to fund programs and be able to measure that impact. And then finally, we're going to talk about obtaining knowledge, and that's my little segue that I mentioned before about LinkedIn and social networking and all that. So, funding operations is truly a great investment. Tell me what this is a graph of. Any volunteers?
Giving USA?
It is from Giving USA, yes.
It's the amount of,
Nonprofits. Number of nonprofits. Well,
Yes, it is the amount of nonprofits in the United States from 2001 to 2010. And your name is?
Trent.
Trent. When you go to AFP Master Trainer School, they teach you these wonderful tricks like giving out prizes to people who participate. So, I know, these lovely tricks. So, as you can see, I have several. Don't be jealous. So this is the number of nonprofits, and as you see, it's been on the incline. Now this lovely graph, and I happen to love the image, and again, if it's, I know some of you in the back might not be able to see it all that clearly. But this is the federal budget. This amount down here is the deficit. So here's the income, $2.57 trillion. Blue is the spending, $3.8 trillion. And the difference is $1.7 trillion, the federal deficit. Now I know we're in an election year soon, and we don't know what's going to happen, but depending on some of the things that are going to be going on, that budget could go up, or the deficit, I should say, could go up. So basically, when we have the number of nonprofits increasing, we have the federal deficit also increasing. Why do nonprofits exist? Does anybody have the answer to this?
Supposedly to fill in the gaps.
Thank you! I love that! New. I like this little graphic. They bridge the gaps between the private and public sector. Now, what is going to happen in the future? So I don't know if anybody follows the presidential campaign, the Republicans versus the Democrats, Mitt Romney versus Barack Obama. You know, if Mitt Romney gets in office, what do we foresee happening with the federal budget?
Cuts.
There'll be cuts. Government will decrease. Now, but also on the private sector side, these wonderful, I mean, I know Jamie Dimon is taking a hit right now for JP Morgan, but, you know, they're making record profits. But they're keeping that money for themselves, they're not adding jobs, they're not taking up public sector services. So that gap is going to increase. So bridging the gaps for the future, we know that the gap is actually going to increase. We know the number of nonprofits is going to continue to rise. And just as a disclaimer, there was a little dip last year because there were 500,000 or so nonprofit organizations that made less than, I think, $50,000 that didn't file their 501c3s, but they'll come back. I mean, they didn't file their 990s, but they'll be back. Don't you worry about that. The federal budgets are probably most likely going to continue to rise no matter who is in government, and especially more if Barack Obama, I mean, not so much more if Barack Obama, because he'll want to add to government. However, you know, it's only going to increase that deficit. And the private sectors, again, they're raking in the cash. So what we can expect is less money from the government for nonprofits. We can expect more gaps in services, opportunities for the private sector eventually, but they're not going to respond right away. They're going to respond when it is good for their stockholders. Okay? They're not going to respond just out of true altruism or out of social responsibility. That's our job. That's the nonprofit sector's job. And so the cost of bridging the gaps, as who so eloquently told me, the man in the dark gray shirt, Steve. Oh, I have a gift prize for you. Steve so eloquently said, you know, our purpose is to bridge the gaps. And the cost of bridging the gaps, and somebody said it over here, the cost is your organization's mission. It's your annual budget. And Jean mentioned in the introduction, you know, her board is saying to her, I can't raise money for tuition. My salaries are our mission. Butler Hospital is a psychiatric hospital. So you think I have it tough. I even work for a psychiatric hospital. So I raise money for a psychiatric hospital. We don't have operating rooms. We don't have fancy equipment. All we have is staff. That's it. So the doctors, the nurses. If you're in school or academia, your teachers, your faculty members, your scholarships. That is your organization's mission. And if your organization mission is also equal to your organizational budget, that's what it takes to actually advance the purpose of your organization. It would not exist without that. So some of this presentation is a little bit of a pep talk, but a lot of it is just reframing how we look at things. The other piece of the pie is, I said, who's telling you this about why you can't fund operations? They're not experts. They're not the people like us who possess the body of knowledge of philanthropy. These are people on your board who are the volunteer champions. And they're reacting to what other people who also serve on boards. They're hiding behind something that they don't really believe or know. You know, it's that false sense of security. I don't have to raise money if it's only for operations. No, we do need to raise money because it's operations. Because if we don't raise money for operations, then we cease to exist. Is everybody on the same page with me? Mm-hmm. They believe in it? Drinking the Kool-Aid? Agenda item number 2. Shift your message. It's all about perception. Before I move on, I mentioned the body of knowledge. I don't know if anybody in this room has had the pleasure of sitting in a Simone Joyaux session. Yes. Simone Joyaux is from Rhode Island, so we get to see her all the time. And I love the point where she says, you all possess a body of knowledge. We've all been in the situation where we've been in a development committee meeting or a board meeting, and somebody says, well, you know, I think you should call Bill Gates. See, it happens, right? It's like, okay. So, but do we turn around to the surgeon and say, you know, I think you should use that other scalpel because it's cuter? You know, do we turn over to the electrician and say, I don't think you should use the white wire, use the red one? You get my point?
Yeah.
Body of knowledge. If you learn one thing today, take that back to your shops. Body of knowledge. You're here and affiliated with a professional organization because you believe in achieving a certain body of knowledge and you want to be better. So I applaud you all for that. Shifting your message. Development is not a department. I know that's a tough one, but in your shops, and I'm not talking about your development shops, I'm talking about your operations, your schools or your hospitals or your mental health centers or your social service agencies, you are just the logistics manager. I often say to my program people, my executive director, my finance folks, I'm kind of like the air traffic controller. You know, I am making sure that Butler Hospital looks good out into the community and that people are being touched in an appropriate manner. The other thing that I'm looking at is I'm managing my operations budget. So because I work with finance and they say, here, we need to raise this amount of money for operations, I know what programs I need to work with or what might be a sellable part. And we're going to talk more in specifics about that in agenda item number 3. So try to think, development is not a department. You can't do it all by yourself. Well, let me take that. Of course you can do it all by yourself, but you're going to hit a ceiling as to how much money you can raise. If you partner with program people, if you partner with your finance folks, if you partner with the CEO and then all the people that are on the line staff, you're going to be so much more effective. Air traffic controller, try to explain that you are protecting your organization's reputation in the community. And then finally, ally acquisition. Make a successful story out of somebody in your program staff immediately. Because peer pressure is an amazing thing. It can be a wonderful motivator. At the bottom of the slide, I have some tactics in which you can employ. And like I said, these slides are online, so please feel free to outline. I want to be kind of sensitive to the time today. You can always reach out to me for further clarification. I will mention a couple of them. When I first came on board to Butler Hospital, I should mention the hospital was founded in 1844, opened in 1847. I think I have board members that are still on from the original board. It was always a psychiatric hospital. It was the first hospital in Rhode Island. Talk about strong paternal protective culture. I mean, I walked through the walls and stigma was stronger inside than it was outside. In order to get and I'm the first chief development officer for the hospital. So talk about a hard road. In order to get our grants, foundation grants program up and running, my CEO, who is my boss, championed all of the department heads and mandated that they put in their individual annual goals that they must participate in a grant proposal or receiving grant funding. So what we did is on a monthly basis, we had a grants think tank. So we have the biggest conference room, we buy them lunch, we bring department heads together, and we review 2 giving guidelines of 2 different foundations that were applicable to our organization's mission. And what we would do around the table, we'd say, okay, here are these funding guidelines, what do we got? What do we got that we're already doing? It did 2 things. Number one, it made it really easy for people to participate in foundation grants. It also brought everybody together. You know, everybody's got these silos. Butler Hospital is the same way. We have 8 different units and 8 different things going on separately. What they found is, oh, you're doing this program, we're doing something similar, what's working, what's not working. And we were able to have hospital-wide programs that we were already doing, that we were already paying for in the annual budget, that we could then submit to foundation grant funding. So believe it or not, I get a substantial amount of money for charity care. Charity care is free care. It is a bottomless pit getting deeper and deeper and deeper. And people are glad to give to it. Foundations are glad to give to it. So you can't tell me, and it's an operations cost. So if people are going to give to that, they're going to give to programs where you can measure the impact. The other thing is I always try to keep in my mind the WIFM factor, what's in it for me. You know, we are technically external locus of control. We understand that things are happening outside of us. We understand that there's all the moving parts. The program folks tend to be more internal and worried about their own things that they can control. So try to have that perspective when you're working with your staff. I know some of you folks might have difficulty seeing this. Did anyone have any questions about one specific one, maybe? We can revisit it at the end if you could. So your program messaging should be directly related to your mission. And I have this graphic of silos here, because I just spoke. Many organizations, I would say most, if not all organizations, have their certain silos. What you don't want to do is, say you're a psychiatric hospital, and you have an art therapy program. I may or may not be talking about a real story. The art therapy program does not make you an arts organization, and therefore you apply to foundations that will only fund arts organizations. That's a waste of your time, and it's diluting your own mission. And when you start diluting your own mission, you're running away from funding operations. You're running away from the whole theme of what we're talking about today, the whole change in perception. And obviously, it's chasing the money, what we don't want to do. Hey, there's this foundation RFP out there. We can do a program like that, right? Everybody's heard that. We can do that. Let's create a program. Let's chase the money. But what you're doing, and here's the way to look at it. In funding operations, you're adding revenue to the operating budget. When you create a budget, when you create a program, you add expenses. That doesn't help you.
Right.
Don't you also creep off your mission? Is mission creep?
Mission
the
creep?
word?
Yeah.
Because you're kind of,
Absolutely. Oh, absolutely.
so that, 'cause like,
And then, you know, and that'll get you the money temporarily, but what happens when the grant runs out? You know, what happens when you have to fire these people? What happens when you have a population that got served because of the grant or a generous donor and then no longer gets served? In the long run, strategic, it's a bad thing. And I will point out, I understand we're constrained by that 12-month budget. It's a downfall for nonprofits. So, what I want you to do when you go back to your offices, hopefully you all have the organizational case for support, which is basically why your organization exists. And then your case statements, and we're going to talk about that in a little bit. When you go back, I want you to make sure that all of your requests or your organizational case for support and all of your case statements, they lead with your organizational mission. And then, when you're looking for a specific program, how does that contribute to the case for support? So in my art therapy program, because we have so many holistic types of treatments in psychiatry, while pharmaceutical remedies are quite popular, the holistic enables that patient to go back home, and when they're feeling episodic, they can employ those techniques that they use in the hospital and perhaps avoid rehospitalization. See the difference? Same thing, it's just framing it different. Your financial messaging. Your CFO is your CFO for a reason. They're worried about the bottom line. Your board typically is a financial message kind of an entity. There are 3 ways to make money in nonprofits. You earn it, you borrow it, you raise it. That's it. That's it. And more nonprofits are getting very, very savvy and leveraging the raise it part. I have this little example about a building project. My hospital happens to be building a building right now. Can I tell you, I'm so excited because it's bricks and mortar and I never get to do that. We talk about easy. But it's a $19 million building. We've already borrowed $10 million to build it. $6 million is going to be coming from board designated funds. So we'll say earn it. And then we're going to raise $3 million. So if you think about how you're going to leverage that, for every dollar that is raised, it's going to be matched 6.3 times by the hospital. So when I'm talking to a donor and I'm saying, your $100,000 gift to this new building is actually going to provide you with a return on your investment of $630,000, number one, and because we serve statewide, our new emergency room is going to be here for you, your loved ones, your friends, for so many years to come. So not only is the $100,000 being turned into $630,000, there's a physical service, an actual service that's going to be there benefiting. Now that's a new building. You can do the same thing with an operating budget, with a program. I do have a a website and a couple more slides that you can refer to that uses this brilliantly. So your homework when you go back to your offices, how is your organization leveraging your donor investments? Because is there anybody in this room that is raising 100% of the annual budget? No. So you look at what your earned revenue is versus your borrowed, and then your philanthropy. And it might be different for all different programs. But this is the thing you have to, and again, because it's all about donor alignment. You might have people that could care less about the investment, but you will have those that really want to maximize that investment. Community messaging. Windows, not mirrors. When we were designing the plans for our new building, we have a certificate of need process in Rhode Island to build new hospital buildings. And we were going through the process, and if you ask anybody inside our hospital walls, clinicians, to say, why are you building a new building? Why do you need a new building? The answer that they would say to you is, to meet the demand, we're always at capacity, we have to send patients out to other psych beds, blah, 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 blah. It was about internal. It was looking in a mirror. It was responding to our need inside. Now, looking through a window, in Rhode Island, just period, there aren't enough psychiatric beds. So when my hospital fills up first. Then the other psych units in the general hospitals fill up. When those fill up, then the emergency rooms fill up with psych patients. So they're taking up bays and gurneys in the emergency departments in hospitals. What happens when they occupy those beds for 2, 3, 4, 5 days, some emergency rooms will go on diversion, which means they can't accept ambulances. So if your daughter is riding her bike and falls and breaks her arm, and you take her to the nearest emergency room, and you're turned away because there aren't enough beds, doesn't that have a very different feeling to you than, well, we're responding to the need, we don't have enough beds in our hospital? There's an actual community benefit. So it's looking through windows, how does your organization benefit the community rather than looking in a mirror? How does it benefit you? I mean, so important. That's a great exercise to have with your development committee, even with your staff if you have a few other people on your staff. And then obviously with executive management, because I guarantee you, very few people are able to look at that. And that's the big mistake that nonprofit organizations make. And that's why it's hard to raise money for operations. The SWOT analysis, is everybody familiar with SWOT? Strengths, weaknesses, opportunities, and threats. It's a great exercise to do also with your development committee and your board, and it enables you to really look at things through windows. This is the example that I was talking about. Sharp Healthcare in San Diego, California. They have 6 hospitals, I believe, and they actually have a freestanding psychiatric hospital. This is a busy slide, so I apologize, but there's a link at the bottom where you can find this. So the Sharp Hospital Foundation is in the middle of a $100 million campaign, no big deal. Not my world. But it's a $100 million campaign to support a $600 million plan to provide advancement at Sharp's respected regional medical centers, blah, 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 blah. So right away, they're using that leverage technique. This is right from their website, and they have beautiful collateral on it. The next slide, and again, please go to the website because it's just super. They talk about the 5 programmatic areas in which this $100 million campaign is going to support. Enhance the level of caring for people in our community. Promote learning that will mean better outcomes for patients. Underwrite the building of modern medical facilities. Encourage the growing and training of our exceptional caregivers, and support Sharp in the way with new technologies and medical advancements. What are those 5 bullet points? They're operations! But they have, from those 5 bullet points, they actually have 32 very specific initiatives that look like it's a little more specific, so that you can measure the outcomes. So again, refer to this, use it with your board, use it in your development committee to get your volunteers in tune and brave, I should say, give them some courage to champion raising money for operations. So this is just a SWOT analysis. Sometimes what I do in this session, we break up into groups and do SWOT analysis of operations, but I'm mindful of the time. Just for a review for some folks or for those who don't know, strengths and weaknesses are your internal perspective. Your opportunities and threats are your external perspective. And those are the ones that are going to help you look through those windows and not in the mirrors. So, agenda item under 3. So we're halfway there. Any questions? We still feeling good? Good. Identify the fundable pieces, and when I say the fundable pieces, I'm talking of your operating budget. How many in this room have a regular meeting with the CFO before the budgeting process? About 6. And there's 25 in the room? You're not unique. These are not unique. So those of you who don't, put it on your to-do list for your goals maybe for next year, because you need to change some culture there. You need to obviously identify what are the fundable pieces in your operating budget. Just a quick review. This is the donor pyramid. And you all work with volunteers often, and I'm amazed at how often I show the donor pyramid, and people are very refreshed. They are very happy to see that again, because we forget. Mm-hmm. We forget how darn time-consuming this job is. What we do is too often we spend our time here. Let's bring in the new donors. Let's get those gifts. Let's get those gifts. We'll spend a little bit of time in getting that renewed gift. But then up here, where the real relationship building and the real money and engagement is, we just don't have time for. And our volunteers, our board members and our executive management, they don't understand why we're not doing this. And Robbie Healy, who's the former president of International AFP, board president, she came to Rhode Island 2 years ago and she did a presentation for us. And she said the most brilliant thing, which was, everybody's thinking, why didn't we think of that? What we do is not hard, it's just really time consuming. That's all there is to it. It's just really time consuming. So obviously the objective in what we do is to align donor interest with funding needs of the organization. So the funding needs of the organization part, that's where the CFO needs to come in. Too many times we're all wasting our time coming up with what can we raise money for. This is part of that creating allies and the internal messaging with your staff. You need to put that back on executive management. Yeah, you can play a role. You act as a partner, but that is not your responsibility. Just for a show of hands, who here has to come up with funding, what to raise money for? Oh, so it's actually not many people, or are you just embarrassed? Case for support versus case statements. Everybody understands what those are. Your organizational case for support is why your organization exists. Case statements, you should have many different case statements for each initiative that you have, because you have several different perspectives. I talked about my new building, and I talked about how basically the new building, the objective that it is fulfilling is increasing access to emergency care in Rhode Island. I'm saying nothing about psychiatric care. I'm saying emergency care. That is a very relevant and salient conversation for community funders, for philanthropists that have that community mindset, for those people that want to make a big impact. The other thing what this new building does is it increases access to psychiatric care, because we're building a new emergency department, but we're also adding a lot more beds into the system. We have a lot of, we don't have big corporations in Rhode Island, but we have a lot of owner-operated private businesses. The cost is lots of documented information about the cost of untreated psychiatric care. So those employees that are costing you money, basically. So we've developed a whole different corporate case support that says, are your employees costing you money? With a whole bunch of data and exactly why those small businesses should support this capital campaign. And it's very effective. 2 very different cases to 2 different audiences for the same project. Again, Giving USA, this is the 2011 annual report, just to remind people that the money comes mostly from individuals, so that donor alignment is so very important. But of course, you have that foundation aspect in there. And then, you know, you got your bequests, but mostly it's your individuals that you're looking at. So, in order to identify your fundable initiatives, start with your organizational budget. And this is where I meet with either somebody on the finance staff. At Butler Hospital, we tend to have many layers. So I would go in and meet with my AVP of finance and literally take out the budget line by line, multiple pages, and say, she would ask, is this fundable, is that fundable, is this fundable, is that fundable? And my response would be, can we measure it? What's the trend? Is it increasing? Is it decreasing? Is it going to go away in the future? What are the industry standards? Which again, your SWOT analysis will help you with that. Refer to your strategic plan. You know, even though we're bound by this, I feel like, you know, we have to have a ball and chain on our ankle with the 12-month budget. But what we're doing today is really what we want to do in 2 years or even 3 years. You know, that's how long the donor cycle takes. So what does the strategic plan say? And I know, many organizations don't have a true, real strategic plan. So that gets difficult. This is the difficult conversation, but the easiest that will help you be successful is, what are your money losers and your money winners? Some organizations, mine in particular, is very paternal, and we want to protect people, we don't want to hurt people's feelings. So saying that our child and adolescent program, for example, is a money loser might hurt the chief's feelings. But that's not that shouldn't hurt their feelings, because they don't have to worry about that. The fact that insurance won't reimburse for a stay longer than 5 days is not their fault. And because a doctor feels it's medically necessary to keep them in the hospital because there are no community resources, I think is a great sell to the community. Mm-hmm. And it is. I'm telling you examples of how I raise money for operations. What are the unmet needs in the community? So we talk about there's no step-down programs for children and adolescents in Rhode Island. So we've created a Saturday program. Now it's, yes, we created the program and it was a new expense, but it's actually one of those money winners. And we're able to get philanthropic revenue to also support it. The other thing about when you do create, this as a disclaimer, when you do create new programs, make sure you add every single expense necessary, not just the expense of the new program. How much time is it going to take of the program VP? How much time is it going to take for accounting? How much time is it going to take for the maintenance? You just kind of build it all in there. Because that way you have a nice pad. And then, like I said, talk to your CFO. Make an ally out of your CFO. I have encountered so many CFOs that have a perception of the development officer that is not correct. You know, keep in mind, all they see from us is the actual ask and when the check comes in. They don't know all the stuff that has to happen in the background. So involve them in the people with whom you do business. Talk to them about, are they happy, are they not happy? Talk to them about the needs of the organization. Because if anybody has the best pulse on the financial situation and where programs might go, it's going to be your CFO. So they're going to know if XYZ program is going to be in existence in 3 years. You might have this great program that's easy to get grants for, and it's not going to be coming in. So then you need to identify your constituents. So individuals, and this is why I showed the donor pyramid, what are all of the entry points? Where are your donors coming from? Again, great activity to do with your development committee and or your board and your executive management staff if you have that kind of a group. Because it gets them to think about, oh, I didn't even realize those could be potential donors. And in a case like a psychiatric hospital, there might be a perception of, oh, we don't want to engage them. It's like, well, why not? Challenge people. Obviously, your foundations, corporations, government used to be a resource, but you know, that's that's not so much anymore. Anybody have any additions to the list that I have here? Sometimes, because you guys have already come up with 2 extra things that I thought we haven't talked about. No? All right, we're on the home stretch. obtain.
Go back to Michelle just to add a couple.
Yeah,
I think that one of the things that
I forgot somebody was over here.
not-for-profits are looking at is, first of all, do they have external business opportunities? They probably have to take a look at that. Some of them are adding some of those,
Yes.
looking at some of those.
Yes.
And I would also suggest that there are ways in which we talked about fundraising, those are starting to build as well, in terms of how people can generate out of the company. Other thing I would suggest is that when you're sitting up with your CFO, sometimes you need to identify that you're the profit center for the organization.
Yes.
And you have to state, look, the cost per doing business, let's say for direct mail is this. For what we get repeats, it costs about 12 cents per dollar what you take in. You have to sort of identify, this is what my budget is like in order to generate X amount or Y amount of dollars
Yes.
extra.
Yes.
You can do that with the CFO, sometimes they can get them to say.
Right. So the suggestion, was when you're talking with your CFO to remind them, number one, that you're a profit center, which I've had that conversation, and sometimes I get deer in headlights. And then the second one is the ROI of your particular, the cost, the investment that you need to make in your specific activities. I would take that one step further. And being a new program for a psychiatric hospital, my ROI at Butler Hospital is not fabulous. It's anywhere from $1 to raise $2.50 or $1 to raise $3. You know, it's not, for a hospital, it's not fabulous. But the hospital in general has a 1% profit margin. So my response to whenever, like, the board tries that, I say, show me another line, a revenue line that's that profitable. And obviously I've gotten away with it since I'm still there. So I've been there for 7.5 years. Yeah.
I just wanted to point out and emphasize under individuals is something that a lot of nonprofits don't do, and that is to really cultivate and move up their current constituents. They're always looking for new.
Yes.
And we must look for new.
Yes.
But it's much more expensive to cultivate the new donors than
Absolutely.
the existing.
Absolutely. I agree, and that's what I was getting at with the donor pyramid, how we kind of focus on that bottom, the base of the pyramid, rather getting the new, and which is why, you know, it's not even a donor pyramid, it's a what, donor trapezoid? What would that shape be? My 6-year-old nephew would be able to tell me, but I don't know. A polygon? I don't know. You know what I'm saying. So I think that the goal, if we were all wonderful, the image, the graphic, is we want a donor square or a donor rectangle. You know.
Well, are you able to take, you go back to the ROI and picking up on Scott's point, are you able to say, look, on a major gift where we continue to renew and we connect with them, it may cost us 10 cents for every dollar we get?
Yeah.
You know, major dollars, can you then get your CEOs to play more
Yeah.
of a role, your board members?
It's helpful. The problem that I have found, and not so much in my own organization, because I'm active in AFP and I work with a lot of different organizations, is they need the money now. They need the money in this fiscal period, and that's why I keep referring to that 12-month time frame. You know, and we've heard it. You know, we need another staff person. Nobody wants to make the investment, so it's, you know, but it's a valid point. And the point was, if the ROI is 10 cents to raise $1 for a major gift officer, would your executive staff then support that? So, and again, this kind of comes off of my Simon comment about the body of knowledge. And I know you all empathize with me in how often we have to defend our position as the development professional. We're always explaining what we're doing. We're explaining and defending why it is so time consuming, why we're not able to do this, or why it's not right to approach this donor. And almost as if we don't have the credibility within our own organization. You know, has everybody hired a consultant? And it seems like they walk on water.
We do.
Oh, well, I will share with you, I do consulting on the side, which has enabled me to stay at my organization for 7.5 years, because it's like a nice balance, but it's, I understand it. It's, you bring somebody in, it's like the gym membership. You know, you pay for that gym membership, you have to go to the gym, but you buy the treadmill and it's in your basement, it turns into a clothes rack.
Our secret is that we really are cool, so we make ice out of the water. That's why we're walking.
Oh boy.
have to use that one.
John, right?
Yep.
His thing is consultants are very cool, so they make ice out of the water and they're able to walk on it. That's why they can walk on it. That's good. I'm going to remember that one. So we have to really defend our body of knowledge. We have to obtain that knowledge. We have to have a very good grasp on the internal and external gaps, the trends that are happening in our industry, and maybe tangentially outside of our industry, if there are some business opportunities or collaborative opportunities. You know, many times they look to the development professionals to provide that information. It's not directly related to our job, but you know, it does help our job. Organizational funding needs are current and future. Go to the people that are outside of your organization. I mean, how often, when I did my interview at Butler Hospital, the second interview, I met with 8 different people. Every single 8 person said to me asked me the same question. They said, how are you going to raise money for mental health? Thinking this was like the biggest challenge in the whole wide world. And I met with a CEO, I met with 3 board members, I went with executive staff. So while there were many red flags going up in my head, and inside I'm saying, I'm not going to raise it, you are. My response, I happen to be coming from a adolescent substance abuse treatment organization. So talk about taboo. So I'm just thinking, hey, this is mental health. It's a step up. I'll be fine. But I'm like, we wish that in the substance abuse field. But I mean, what are the people outside your organization? That's an example of the people inside. You know, talk about alignment. I don't know that they're, you know, all true north or anything, but they're all aligned in how they're feeling, and they're feeling that our organization is not worthy of philanthropy. So go to the outside. What are they thinking? Be involved in diverse networks. Your participation here today is a great start. It's nice because you're all fighting the same fight, but you're all from very different organizations, and you have very different experiences. There's so much that you can learn from each other. Best practices. Now again, thanks to technology, you have access to the AFP website, the international website, you can refer to those. Participate in some other organizations, a PPP, which used to be National Plan Giving Council, Partnership for Philanthropic Planning. I don't know why they changed it to that, but anyway.
That's their tagline now.
Oh, yeah. It should be.
Yeah.
But get outside of that. 2 years ago, I joined the board of the American Red Cross, the Rhode Island chapter, which coincidentally merged with Connecticut. So, hey, I'm one of you guys. But what's nice is that enables me to wear a true board member hat. You know, I'm not the token fundraiser. I actually chair the nominating committee. Everybody has to raise money on the Red Cross board. There's no fiduciary responsibility. That's the one thing you have to do is raise money. So if you're all looking for a sample, look to your Red Crosses because that's how their board members have to participate. But and then embrace opportunities for peer learning. So the best practices don't have to come from actual people. They can come from groups, the AFP Open Forum and LinkedIn. And I mentioned this on this slide. There are other professional organizations, while AFP I know is the best. You know, like I said, I'm a board member. You have AFP, if you're in education, CASE, there's probably some CASE members in here. AHP, PPP. Many of those gatherings you can go to without being a member, so they'll have membership networking sessions or whatnot. Alumni groups, perfect, because then you're networking with people that are maybe even decision makers in your community. So when you're meeting, going to your alumni reunions or any kind of Bryant University, I'm an alumna of Bryant University and Rhode Island College. So Bryant tends to have a lot of business-oriented type things. And so I'm going to little sessions with other business-oriented type people who, you know, might be prospects. But I'm not the development officer. I'm Michele Berard alumna. You know, and same thing at Rhode Island College. So you want to participate in opportunities that you don't necessarily wear that development officer hat, because it builds your credibility in the community. If anybody golfs, join a golf league. It doesn't matter how bad you are, everybody sucks. So. I speak for myself. But and then the rubber chicken circuit, the Rotary clubs, Lions, all that good stuff. And then finally the internet. LinkedIn, I'm very, very active on LinkedIn. Facebook, not so much, and I make an attempt at Twitter. The groups are fabulous on LinkedIn. There's an on-fundraising group for AFP. There's a CFRE group that you don't have to be a CFRE in order to participate. It's a great way. You can throw out a question and get all these different responses, and there literally is dialogue that's happening through these groups. And it's really, really useful. My CFO at Butler wanted to charge overhead on unrestricted foundation grants and annual fund contributions, because that's how our hospital has operated, because we're a research hospital, so we get a lot of overhead from those federal grants. And I said, that's not a best practice. It's donor intent. You know, we've asked the donor to support this, and then you're doing that. Then they would argue, well, you know, we have to process the donations. And I said, you're going to pay those people anyway. That's the cost of doing business, which is also a very good comeback. But the other piece of the pie is, hey, don't go by intuition. And yeah, I know you possess the body of knowledge. Put it out there. Put it out there on a bunch of different groups, and collect those responses, and then show them to your CFO. Show them to your CEO. Show them to your board chair. Because it is amazing the power. It's almost like hiring a consultant without hiring a consultant. And then you get the credibility. I have some examples here. You know, like I said, I'm fairly active on LinkedIn. And so several people have, you know, asked me to meet with them. Oh, I noticed your profile on LinkedIn. Lenny Silva is from Sovereign Bank. And Sovereign Bank is a bank in Rhode Island and Massachusetts. He's a senior vice president. And he's like, oh, I noticed your profile. I'd like to meet with you. I said, oh, okay. So, and he and I remain in contact all the time. But it's just kind of funny, because once you get engaged in these different types of networks, you're not only the scary development professional. Like when you're only in those networks, you're the scary development professional. And I'm saying this, you know, with my peeps. I don't say that in public. Same thing with Northwestern Mutual. Andre Savage is a former Boston Bruin professional hockey player. And Rhode Island's very small. We all know each other. And so he actually contacted me on LinkedIn and said, oh, I noticed your LinkedIn profile. I'd like to meet with you. He's brand new in the industry and needed some help in networking. Well, coincidentally, I'm actually planning a hockey fundraiser in September. So I was like, I'll bring you into my little group. And then just this week, I got an email. I talked to them 2 weeks ago. The philanthropy department at Stanford University called me. And they said, well, they sent me an email. And they said, oh, I'm so interested in your post on Grateful Patient Program for a psychiatric hospital. We are going to branch out to psychiatric philanthropy here at Stanford. Can we call you so you can advise us? Well, his title was Chip something, physician liaison to the medical staff. So my reply was yes, and I'm very interested in your title. So their development office employs a doctor that works with the physicians in the hospitals. I was like, ooh. Not in my world, but hey, these are kind of cool ideas. So the point is, they were calling me for guidance, but I also use them as well. And these are all great networks, and because I possess this all adds to my body of knowledge. It makes me a better development professional. It makes me a better coach and mentor and a champion for the cause. AFP has an open forum, which is also very good. So where are we with time? My watch is over there. So we've gone through the whole presentation rather quickly, and everybody's still awake, so that's good. So let's just have a shout-out brainstorming session. Why can we raise money for operations? Oh, wow. Do we have to do it again? In the back, all the way in the back.
It does meet the need of the donor.
It fulfills donor intent. Anybody else?
Advances the mission.
It advances the mission of our organization. Somebody else?
Allows us to do what we say we're going to do.
That's right. Allows us to do what we say we're going to do.
It is our mission.
Operations is our mission. It's why we exist. How? How are we going to raise money for operations? Asking. That's How often do we hear that? You don't get it unless you ask. I heard something in the back.
Is it case statement? I mean,
Having a clear case statement, aligning donor intentions with funding needs of the organization. Did I see a hand over here?
Engaging the departments in the whole programming.
Engaging your
fundraising.
departments in your organizational mission, making allies out of your fellow employees. Somebody else?
Engaging your board of directors in the process.
Engaging your board of directors in the process and educating them, making it not this big, hairy, audacious thing.
Repositioning your message.
Repositioning your messages. It's so important. And there's all different messages. Yes. One more? All right. Whoops. And think about your own organizations right now. What is going to help you to raise money for operations? Do you all have programs that you're thinking of right now? Do you all have specific tactics that you're thinking of right now? Willing to share? Not really? You gotta let it settle? It's okay. So your organization exists for a very good reason. It doesn't matter what your organizations are. It's filling a very, very important. Rhode Island, the nonprofit sector, is the largest employer. So this presentation works well in Rhode Island. So your job is to find the individuals and stakeholders who need to see it continue. And there are many. There are many. About 10 years ago, I had a board member when I worked for the Adolescent Substance Abuse Treatment Organization. And yes, his name is Harry Potter. And I was meeting with him, and I remember he had this little fortune cookie taped to his computer terminal. And I don't even remember what we were talking about. And he said, you know, Michele, I've had this for a while. I need to pass this on to you. And the fortune cookie saying is the greatest pleasure in life is doing something that others say is impossible. So I don't have I still have that fortune cookie saying, but I share it as much as I can because I think it so relates to what we do as development professionals. It's just vital. It's vital to so many successes. And I'm very good for free advice and continued dialogue and looking forward to network for future and add to my own body of knowledge. So please take down my contact information. That's that. Now, are there any questions that anybody would like to share, discuss?
Back in the beginning, you had a slide about, I forget what the total amount was in the free areas in
Yep,
which the revenue was
the
coming
leveraging.
from. And one was earned. Could you just